The 4 pillars of heart failure management. Good morning and welcome to today's episode of our heart failure awareness series. Every great recovery starts on a strong foundation, and for heart failure, that foundation is the 4 pillars or the fantastic 4 of heart failure management. Heart failure is a serious condition. In fact, it carries a higher mortality than many cancers combined, but there is hope. Modern treatment has transformed the outcomes, helping people live longer, feel stronger, and stay out of hospital. So what is the goal of heart failure management? The goal of heart failure management is 1. To relieve symptoms, 2. To prevent hospitalization, and most importantly, to reduce the risk of death, reduce mortality. The goal is not just to survive, it is to live well and live longer. That is why doctors begin the 4 pillars of heart failure treatment, or the fantastic 4, immediately after diagnosis. Each class supports a unique part of your heart's healing journey, and it's important to be on the 4 unless contraindicated. So today we learn about the 4 pillars of heart failure management. Number 1, ACEI, ARNI, or ARB. These medicines relax the blood vessels and reduce heart strain. They help the heart to pump more effectively, and they reduce the disease progression and reduce hospitalization and death. You will be on one of these 3 depending on your condition or tolerance. Number 1 is what we call ARNIs, angiotensin receptor neprilysin inhibitors. That is a combination of sacubitril and valsartan, and this is the most preferred option of the 3. Number 2 is ACEI, angiotensin converting enzyme inhibitors. From here we have drugs like enalapril, lisinopril, lamipril, captopril, the prils. The number 3 in this pillar 1 is ARBs, angiotensin receptor blockers. This include the sartans, losartan, valsartan, cadisartan. When used together, these pillars, you will be put on one of them. ARNI, ACE, or ARB are not together, but preference is the ARNIs. Think of them as the foundation. They help the heart work with less stress or pressure. Pillar number 2 is beta blockers. These slow the heart rate, they reduce your blood pressure, and protect the heart muscle from stress hormones like adrenaline. They reverse the remodeling. Over time, they help the heart to recover its strength and pump more efficiently. These are the carvedilol, bisoprolol, metoprolol, or nebivolol. You'll be put on one of those by your doctor. They give your heart time to rest, heal, and rebuild, like putting it on a recovery mode. Pillar number 3 is MRAS, mineralocorticoid receptor antagonists. These help remove excess salt and water and reduce swelling. They also protect your heart against further scarring and remodeling. The options here are 2. You have the spironolactone or the aldactone and eplerenone. So this is pillar number 3. They don't just fight fluid retention, they actively protect your heart from further harm and the muscle from strain. Then we have pillar number 4, SGLT2 inhibitors, sodium glucose cotransporter 2 inhibitors. These drugs were mainly used for diabetes, but they have become a key game changer in heart failure treatment, even without diabetes. So please note, you'll be put on these drugs for heart failure, even without diabetes. They help remove the excess fluid through the urine without overloading the kidneys, and they also protect both the heart and the kidneys. And the options here are 2, dapagliflozin and empagliflozin. These act like a gentle drain, easing the heart's workload and also improving symptoms fast. So when used together, these 4 classes of drugs which you should be on, the ARNI, the beta blockers, the MRAs, or SGLT2 inhibitors, they improve the heart function, they reduce heart failure hospitalization, they relieve your symptoms like breathlessness, fatigue, and swelling, and increase life expectancy, reduce mortality. The fantastic 4, the 4 pillars of heart failure management. Important reminder, never stop or skip your medicines without consulting your doctor. If you notice any side effects early, please alert your doctor early so that the drugs can be adjusted. Take them consistently. They work together when used as a team. That's why we say the 4 pillars. You have regular follow-up so that your doctor can adjust the doses. And the earlier you start, the stronger your heart's chance to recover. Remember the fantastic 4, the 4 pillars that are used together, and they improve morbidity and mortality of heart failure. Heart failure treatment today is more effective than ever. When started early, taken faithfully, these 4 medications and the 4 pillars can restore energy, make your recovery, improve your EF, and also improve mortality, reduce the risk of death. Heart failure is serious, but it is also treatable, management, and full of hope when every part of the management is taken. So please stay tuned for the next episode 13C, where we will discuss other medication used in heart failure. What about diuretics? What about your blood thinners? Does aspirin or statins have a role? And the digoxin that is commonly used? So stay tuned when we will discuss about more other medications apart from the 4 pillars used for heart failure management. So over to you. Have you heard of the 4 pillars before? And if you have heard of them, are you on them? So please like, share, and follow so that you do not miss any episode. Dr. Beatrice Muthui-Mutua, saving lives 1 heart at a time.